Hi guys, this is Chris Fehres from Fehres Energetics, and today I'm going to do a demonstration of a shoulder treatment for you with acupuncture and electroacupuncture. So I've recently gone back to doing weights at the gym, and I'd forgotten about a underlying deficiency or weakness I have in my left shoulder. So after doing a couple of sessions and going pretty hard out and looking forward to the changes, I've woken up this morning and had this pretty severe pain in my left shoulder. Actually, it started yesterday and had a bit of a massage with it, and I felt it got a bit better, but woke up this morning and have gone to lift my arm up and it's in a great deal of pain. So I did a few different movements with it just to try to isolate and see what's actually wrong with the shoulder. So what happens is if I raise it here, that's when the pain starts, up in here. And then if I go to the side, it's fine up until about here. And then this is when the pain starts, and it's pretty bad, all the way up to there. And then the pain stops again. And then the range of motion is fine above 90 degrees. So trying to figure out what that actually is. I test the muscle strength. It's not the deltoid, anterior deltoid. So going forward to the side, and then as well as I can on my own without someone helping me, pulling backwards, so going that way. So that isolates the anterior deltoid, the lateral deltoid, and the posterior deltoid. So it's not any of them, it's not a tear in the muscle. So then the other test is the Yoakum test, where you put your hand across to the other shoulder, and that's already starting to hurt. And then you raise the elbow up without moving the shoulder, and if that reproduces the pain, then it's likely that there's an impingement of one of the rotator cuff muscles in there. And I'm thinking it's the supraspinatus, which comes over from the top of the scapula, above the spine of the scapula, comes through under the acromion and attaches onto the head of the humerus. So it makes sense to me that that's what's going on, because it's fine here. Usually the supraspinatus flexes in abduction of the arm, so to about here. It says 15 degrees, but that's not where it's hurting. The pain starts after that, which is supposed to be your deltoids, but there's no pain in the deltoids when we do resisted flexion. So it's most likely what's happening is there's an impingement. So something has happened when I was doing weights that has aggravated the tendon or the sheath of the tendon in the supraspinatus, which has enlarged it due to inflammation or some aggravation. And then that's going in between the head of the humerus and the acromion. So as I lift up, the joint space is becoming smaller, which is pressing on the supraspinatus and causing a lot of pain. But then as you go higher, the joint space opens up again, and then there's no pain. So considering that, I'm going to do some acupuncture and see if we can help to reduce the inflammation and relieve the pain. So the point of this video is to show some of my patients and the general public what goes on in an acupuncture treatment, and also for other acupuncture practitioners to learn a bit about what we do, if there's something out there that can help you improve your own treatments. So let's get started. So most of the pain that I'm feeling when I start lifting is right in there. So even though the impingement is probably a little bit higher up, the pain of the tendon is referring down into between the anterior and the lateral deltoid here. So that's where we're going to stick the needles. So I get myself into a nice comfortable position where I don't have to move for a bit, and I can put the electro on. So starting where we get most of the pain, go straight in. And then I'm just going to follow that line down. And then probably up towards the top as well, where it's likely that it's getting impinged. the easiest way of treating, but sometimes you just have to do it. So just getting a bit of that dull sensation. The purpose of this treatment is not so much to release any of the muscles, so I'm not trying to get any twitch sensation or anything like that. Then I'm also going to put a needle into colon 11 and colon 4, which are the chain and lock points, they're called. So they're along the channel, the same channel as this here. So coming down on the arm and the elbow and on the hand. We've got colon 11 and colon 4. Okay, so you can see the points we've got in here. The sensation it's giving me is a dull heavy sensation, which is pretty much in the exact same point where I'm getting the pain when I move my arm. So now I'm going to hook up the electrodes to it. Okay, so I've got the electrodes all hooked up, just making sure that all of the levels are down on the machine before I turn it on. So I like to use the variable setting for the electro machine, so it varies between a slow frequency and a faster frequency. So the point of this is that below 100 Hertz releases endorphins and enkephalins in the body, and anything over 100 Hertz and over releases dynorphins. So even though dynorphins are more related to the spine for spinal injuries, so they're up to 200 times stronger than morphine, and it's understood that the purpose is that if you have a spinal injury, dynorphins will be released to help you escape the injury, to save yourself before you feel any pain. So even though that's not really the case of what we're doing here, we're mainly aiming for beta endorphins and enkephalins. The purpose still in this area of doing the variable speed between the frequencies is so the body doesn't get used to the electro, so it doesn't gain a tolerance to it basically, and it still keeps stimulating the body. So the machine's going, and I'll just turn up the first one. So we've got the white one going, got the yellow, 2 yellows on a single needle, and then the red's going to separate needles. So this basically increases the surface area of the stimulation. So we're going to turn the first one up until I can just start to feel the sensation, tingling sensation. So you can see that needle's twitching there. So that's a nice mild sensation at the moment. I'm now going to turn the back one up. So turning the back on now, I can feel that kind of dull sensation going down where the line of pain was I had before. Woo! Okay. So that's at a good level there. So it's contracting on constant, now it's doing the tapping. Now as long as this is comfortable for you, the continuous tapping, the contraction of the muscles is not a bad thing at all. It's just the similar effect as just you contracting your muscles yourself. Helps to get more blood into the area, helps to release more of the neurotransmitters and the natural painkillers that the body has. So we're going to let this sit here for about 10 minutes and let the treatment do its magic. So the other thing I'm going to do while the electrodes are on is do some moxibustion, which is heat treatment for one of these guys. So traditionally the moxibustion was a stick of fermented mugwort, but usually these days we use the smokeless version, which is mostly charcoal, because when you're in a confined room all the time, you end up with some pretty smoky lungs if you use that too much. So what we do with the moxa stick is hold it near the part where we're treating and get some warmth. You can see the skin starting to go pink. Now, it may seem counterintuitive that you're putting heat into an area of the body that is in pain due to potential inflammation, but the idea is that the electro is releasing neurotransmitters and natural painkillers, and by putting heat into the area, you're expanding the blood vessels and speeding things up, so it allows the neurotransmitters and all of the good nutrients to get to the area quicker and allows it to heal quicker. So this may be part of the reason why you can feel some soreness after a treatment, but then quite often, or most of the time, you wake up the next day and you the treatment has worked and you have a great deal of pain relief. So to finish off the treatment, the mox is done. Usually you put the electro on for about 10 minutes, then let the patient relax for a while with that, and then come in with the mox and do the mox for 5 to 10 minutes. And usually what will happen, even with the varying frequencies on that setting, the body will still get used to it. So after about 10 minutes, usually come in and turn them back up just a little bit so the patient can feel them again. So that other one has already fallen out, that other needle, with the when I pull the clip off. Okay, so at the moment, actually that's made a fair amount of difference already after just doing 15 minutes of electron and moxa. So that's already started to promote the pain-killing effects in there. So after this, what I'm going to do is strap it with kinesiology tape, which will help to support the area. Also, the idea is with kinesiology tape is that the tension of the tape lifts the superficial structures of the skin and the fascia from the underlying structures, which allows more blood flow to go through, and also gives you proprioceptive awareness of your joint and your arm. So when you're moving, you're more aware of it, so you don't overdo it too much. So I'll put the strapping on, and then we'll talk about some aftercare treatment and how you can prevent this from happening in the first place, unlike what I did. So there you have it, the treatment of an impinged supraspinatus using acupuncture, electroacupuncture, moxibustion, and kinesiology taping. So the great thing about kinesiology tape, first of all, as I said before, it helps us support the area, gets more blood flow, and also helps to reduce you from exerting your arm, overdoing it while it's still in the healing mode. You can also apply liniment straight to the tape because it's water resistant. Usually it lasts anywhere between 2 to 5 days, depending on the person and depending on what activity they're doing, but you can wear it in the shower. So because it's water resistant, you can use something like wintergreen liniment or tiger balm or something like that and apply it straight to the tape after about an hour or so when the glue is taken hold. You can apply it straight to it and it works like a herbal plaster, so you get the effect of the liniment also with the added bonus of what the tape does. So in the next 24 hours, what I would do for post-treatment care is definitely do not go back to the gym. That's a pretty obvious one. But make sure that if this is you and you've just had acupuncture for your impinged rotator cuff muscle, that you don't overdo it. You may get some positive results in the initial treatment like I have. Like the pain has greatly reduced. The impingement I can feel is still there. but I'm going to do an update for this video tomorrow when I wake up and see how it's feeling. Usually the best results of acupuncture happen within 8 to 24 hours afterwards, so the next day when you wake up. So I'll record the progress of it and let you know how that goes. So what you want to do, while it's still feeling good, you don't want to overdo it thinking that now it's improved, that you then go and, you know, like I said, go back to the gym or something the next day and then exert it and then make it worse than it already was. If this was a patient that was coming to me, I would advise that they come back within a few days for another treatment, especially if they've only just done it. The quicker the treatment you have after that you've done, after the injury has occurred, the higher the chance that you have of improving a lot quicker. So even though acupuncture is an amazing form of treatment, it's unlikely that one treatment is going to fix it. Just like many other modalities, several treatments at least is advisable to return you back to a regular state of health. Because if you have one treatment, you're going to probably get some really good results, and then if you don't go back for another one, then those good results are going to fade and you're going to go back to how you were. Potentially worse if you then exert yourself feeling, you know, in that 24 hours when you're feeling better. So the idea is, as you're coming back down, you have another treatment to catch that and maintain the momentum and then keep it going. Ultimately expanding the time in between treatments, getting you back to feeling better again. So so for those people who are patients who are interested in getting acupuncture or have an injury similar to this, you can see that that modern acupuncture, or my style of treatment, is fairly comprehensive. I use a lot of the tools as much as I can. Acupuncture, electroacupuncture, the moxibustion and the taping as well, to give it some support afterwards. And I'll also show you some stretches if that's required. You can obviously see that it's not an uncomfortable experience or painful, or else I wouldn't be able to do it on myself so easily. Obviously there can be a bit of discomfort because we're working with needles, but most of the time it's pretty enjoyable. So as for preventing something like this, ideally what I probably should have done was some stretching before I went straight into my workout, straight head on in and went straight to the bench press, or some light weights first to get the muscles used to it. I did do some Tai Chi to start off with beforehand, which warms up the body and warms up the muscles, gets the blood flowing, but it's you know, doesn't exactly prepare you for lifting, you know, lots of kilograms and going straight into a full-on workout. So ideally, yeah, some lighter weights first to get started, get the area used to it so it can then prepare for the heavier weights. So as I said, after my outro, I'll put a little bit on the end of the recording for tomorrow. And for the people that are watching this, if you're interested in having a treatment, get in contact with me. And for practitioners who are watching this, I hope I have provided you with some information and some techniques you may not have already thought of before. So thanks for watching, everyone. I'll see you next time. This is Chris Fehres from Fehres Energetics. Cheers, guys. Okay, so it's the next day, and the result of the treatment is it's a whole lot better. I've got most of my range of motion back, going forward and to the side. There's still the slight impingement about there, up to about there, but the pain has reduced by, I would say, 80%. So that's a huge improvement. As I said, I wouldn't go back to weights straight away because it may just cause the results to go backwards. But I'm fortunate enough to be able to get some more acupuncture today from a colleague, so I'll go and get that done, which will improve the results even more, and then probably give myself another couple of treatments in the coming week until it gets better. The technique that I was using with the electroacupuncture, where you apply the 2 yellow clips to the single needle and then separate the 2 red clips out to the 2 other needles, I learned that from a practitioner called Brett Montgomery, who has a practice at Kingscliff called Kingscliff Acupuncture and Massage. And if you're a student or a practitioner and you get the chance to go and see one of his seminars about electroacupuncture, was treating back pain, the one that I went along to, learned some really valuable information and have had some great results using his techniques. So check him out if you can. So that's pretty much all from me. If you've got any questions, please let me know. I'll do some more videos in the future treating some other aches and pains. I've got plenty of them that I can do on myself. So until then, thanks for watching, guys. See you next time.